paste bottle feeding. What is paste bottle feeding and why is it a good idea to feed your baby with this technique? So paste bottle feeding is a technique of giving a bottle of either milk, whether it's formula or express breast milk, but giving it to baby, but in a manner where baby is sort of driving the feed, that you're cueing in to their needs and whether they're hungry or not, and how much milk and what sort of volumes they want. It's also a technique that's trying to mimic breastfeeding, so that for women who are especially giving a bottle and breastfeeding, it's trying to have a little bit more consistency, so baby's still working hard to get that milk out. So, and this is opposed to if you are feeding, which many people do, but having baby lying down and the milk is just tipping into their mouth, and they're often, when they have their little pauses, the milk's still dripping in, or they might be having more milk than what they might actually need or want at the time. So how do we do paste bottle feeding? So the first thing is we sit baby quite upright, holding them and supporting baby quite firmly behind the back there and also around the bottom. Baby needs to be able to cock her head backwards to drink. So with this doll, it's a little tricky, but being able to tip the head back, because if you can imagine, if your head is down like so, if you have a glass of water, it's very hard to drink it. So with bottle feeding and breastfeeding, baby needs to be able to cock their head back in order to drink. So once in that position, you're holding bub lovely and close, so you've still got that really nice mother baby or dad baby or partner baby, whoever baby bonding going on, and then you will offer the bottle. So the normal pattern of breastfeeding is when a baby is feeding directly off the breast, is that they will suck, 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 and then they have a little pause, have a breather, and then if they're still a bit hungry, they might suck again, suck, 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 and a little pause. And so we're trying to mimic that. So keeping in mind with the breastfed baby, when they do have the little pauses, the milk drops off and stops. So, and then when they suck again, the milk starts flowing again. So that's what we're trying to achieve here. So if you can imagine that there's some milk in this bottle, and initially starting with sitting bub, like we said, quite upright, but still able to tip their little head back, and often stimulating their lips with the teat there, just to stimulate their sucking reflex, so they realize the milk's there and they're getting ready to suck. Once they do look like they're going to suck, then that's when you would tip the bottle up so that the milk level covers the hole in the end of the teat, and hold it up there while they suck, 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 and then they have a little pause and you drop it back down again. And then just again tuning into their cues, and if baby looks like they want a little bit more and they're starting to suck again, that's when you tip it back up and they have a little pause, and then you lower it back down again. So that's the essentials of paste bottle feeding. It's important that you do, for different feeds, mix it up a little bit, move them around to the other side so that they don't develop a real preference for feeding one side or another. But yeah, if you can just slow that milk down, let them drive it, you're cueing into how hungry they are, they'll often have better volumes, and it's a really good tool, whether your baby's completely on formula or whether they're getting little bottles of express milk. It's a good technique to practice. So experiment with it and see what you think. Yeah.